Okay, I think we're recording, which is great. Okay, so I'll start with the first question. You previously explained that free and pay what you wish care was launched as a model for the Weissman Children's Foundation during 2020. Could you speak of what sparked the creation of this foundation and how it extends the mission of the Child and Family Institute?
Yes, and I just wanted to say thank you so much, Gabby, for having me on the podcast today. Really excited to be here. Um, and first, I just want to say that I'm very excited to be partnering with the Westchester Children's Association and the Westchester County Youth Bureau to create a potential scalable solution to the youth mental health crisis. More specifically, bringing free, culturally affirming mental health care to the county's underserved children and families. I started the Child and Family Institute, or CFI, back in 2011, following my postdoctoral fellowship at Judge Baker Children's Center at Harvard Medical School, where I co-led multi-state clinical trial evaluating the effectiveness, training, implementation, and sustainability of evidence-based psychological treatments with the child welfare population. Um, and with my colleagues here at CFI over the past decade or so, I developed new models of clinical dissemination and implementation, um, and with the goal of broadening mental health access to more remote and underserved communities, which we recently presented at the World Congress of Behavioral and Cognitive Therapies in Berlin. And CFI itself features over 50 mental and behavioral healthcare specialists and programs, as well as immersive doctoral and social work training programs, an equity and effectiveness scientific council, and an innovative diversity, equity, inclusion, and social and health justice task force. However, I kind of realized a few years ago that although we've been able to do a lot of good and help a lot of people through CFI, we were still missing the ability to provide a completely free, evidence-based care to underserved communities that have been historically denied access. And specifically, folks who, uninsured, underinsured, as well as families who were unable to find adequate or timely care within their insurance networks, which is a growing issue in our field. So I decided to launch a nonprofit solution, which is the Weissman Children's Foundation, about 1 month before COVID, which you can imagine was very interesting and very challenging, and also very rewarding. And as far as challenges go, because of the rapid onset of the pandemic, we didn't have time to gradually ramp up as you normally would when starting a nonprofit organization, which is very intensive. So we decided instead to roll out and self-fund a comprehensive COVID mental health relief initiative. And we were very fortunate to be able to help over 1,000 underserved children and families for free or at a very nominal voluntary fee over the past 3 years.
Awesome. So you kind of spoke of the difficulties and the positives that came about from launching in 2020. But did you have an idea prior to 2020 for launching the Weissman Children's Foundation, or was this in direct response to the pandemic?
So this is something that I've been thinking about for a long time, since my days as a postdoctoral fellow at Harvard, even before that, as a PhD student. And the timing was just very interesting and fortuitous that I put the wheels in motion. Literally, I think it was like 3 weeks before the pandemic started. So I was already formulating this and launching this concept, and there was a great need and a mounting mental health crisis pre-pandemic for many, many years, for many reasons, which we'll get more into. And it just so happened that the global pandemic started 3 weeks later, and then it was like, okay, what do I do now? We don't have time to, necessarily like do all of the 501c3 documents right now, or launch a fundraising campaign right now. So what can we do to help families immediately? And And fortunately, we have a lot of resources through the Child and Family Institute that we're able to leverage, including all the pro bono therapists providing free services, our training programs providing free services, and we were able to help lots of people just, again, kind of self-funding, grassroots effort, and then still kind of put the dotted the I's and cross the T's for the nonprofit or incorporation and development over those 3 years. We took our time with that, but we just wanted to get relief out immediately to as many families as possible. So, yeah, it just happened to be a very interesting timing, and with both, like you said, positives and challenges. And overall, it's just been a wonderful, feather in our cap to be able to help so many people so quickly, and it's been a wonderful service to the community, and to be able to help so many people so quickly. And it's allowed us to get the word out about what we've been able to do, and then create partnerships like the one we're doing. And it's just really, really wonderful and rewarding. And now there's so much that can come from this, and the momentum has been just fantastic and humbling, and just I'm just so happy to be a part of it. So
awesome. Yeah, so you hit the ground running, kind of just to get everything sorted out. And you were kind of thrown into it, but obviously we're 3 years out of the pandemic now. It's 2023. So although this is a really general question, has there been an increase in the need for child and family mental health resources that you've noticed?
Yes, definitely. And again, as I'm sure many of us in the field are aware, there's an escalating mental health crisis before the pandemic, which has really surged during COVID, disproportionately affecting vulnerable and underserved populations as well. And I have a few different stats here. In May of 2022, the White House reported that half of women and a third of men have experienced deteriorating mental health since the onset of COVID, with 50% of young adults reporting symptoms of depression, and women, children, and Hispanic and Black people being most acutely affected. And according to the 2023 State of Mental Health in America report, 53% of youth with depression in New York State went untreated this past year, with 1 in 10 families who paid for private insurance not receiving any mental health coverage, and 11.1% of families with mental illness completely uninsured. And in 58% of all New Yorkers with any mental illness went untreated this past year, with a quarter of those reporting unmet need as a result of barriers to care, which may include things like inability to afford treatment, limited or complex behavioral health care networks with poor quality of care, and issues of stigma and lack of cultural sensitivity. And finally, on the insurance front, in the United States, mental and behavioral health coverage is very limited, with as high as 63% of behavioral health care occurring completely out of network in some regions like Washington, D.C. And in addition, in-network mental health providers are poorly compensated, disincentivizing providers with more specialized training from accepting insurance, leading to these expensive insurance plans, with which we're already paying for, with insufficient mental and behavioral health care networks, and coupled with rising costs of expensive out-of-network mental health services. So the overall challenge affecting our community, including right here in Westchester County, is difficulty accessing high-quality, effective mental health care that's also culturally sensitive and financially within reach. And perhaps saddest of all, another stat here, according to a 2020 Mental Health America report, our children may actually be struggling the most and experiencing the highest rates of suicidal ideation, which is really sad, with more than half of 11 to 17 year olds who completed an online screening survey reporting frequent thoughts of suicide or self-harm over the previous 2 weeks. So at CFI, we have been kind of acutely aware of these issues for quite some time in our community. Again, even pre-pandemic, And in response, we launched the Weissman Children's Foundation, or WCF, which is now uniquely positioned to address this need by offering culturally informed, evidence-based care to really anyone who needs it.
Mm-hmm. So there is that growing need, but it's also hyper-specific, that we want to be able to cater to individualize, unique, I guess, needs, and also accommodate to these culturally sensitive, well-informed, I guess, guidance, we can say.
Yeah, absolutely.
So we established that there is a growing need, but do you think that this stigma against mental health care, or the stigma to receive mental health care, has lessened at all, and that might lead to more people seeking care?
Yeah, I think this is a complicated and great question, and it's complicated. I do think it has for some. But unfortunately, the field of psychology is way behind the eight ball when it comes to diversity, equity, inclusion, and justice. 3% psychologists of color, I think, is the latest stat on that. Mm-hmm. And as I mentioned before, shame and stigma and lack of cultural sensitivity is still the most significant barrier to care. So side note, I actually spent the last 2 years engaging in curiosity conversations and focus groups through the Westchester County's Launch 1000 program. I was typically the only person who looks like me, so a white male, in my accountability groups. And I was honored that my colleagues of color felt safe enough with me to open up with me about their experiences seeking mental health services. And the most common barriers that they shared with me were, quote, my therapist didn't look at me, he didn't understand my story, I didn't feel safe. I maybe went once and never went back and decided to talk to my minister or reverend or my grandmother instead, or I just kept it all inside, things like that. And so I was really humbled by that experience, and more than ever, I have a deep appreciation for the importance of engaging community voices, trust and humility, and collective impact as essential precursors to innovation, to creating sustainable mental health solutions and systems of care that will work for everyone. And it's honestly really hard to know, I think, as a parent or as a mental health consumer, where to go to get affordable, safe, and effective help, perhaps even more so for communities of color. And I think my Launch 1000 experience also sparked my interest in helping to co-facilitate Westchester County's faith-based mental health initiative, which is a collaboration with local faith leaders and the national Soul Shop for Black Churches movement. So when Commissioner Michael Orth asked me to help out, we joined the planning committee and are becoming now a trusted referral source for families in the local Black church community. And in a similar vein, Commissioner Orth also invited us to partner with the county's police chiefs in developing an app to reduce stigma, where law enforcement families can feel safe connecting to culturally informed care. So those are some of the ways that we at CFI and WCF are actively working to reduce stigma here in the Westchester community. And I should also mention that we have some other community partnerships on the horizon this fall, including with the Jewish Community Center and the YMCA here in Tarrytown.
Right. So obviously you've been expanding access across lots of different platforms to meet with different groups of people and really give them the access that they need. And that does lead into my next question, which is, how have you addressed accessibility to your services? And this is a really broad question, but of course it ranges from digital access to transportation limitations, and lots of families, perhaps they have working parents, they might not even have the time to take their child to see a mental health supporter. So how have you kind of combated or identified and then addressed these issues in accessibility?
Yeah, that's an important question as well. One of the ways that we've addressed accessibility is by creating flexible office space, therapy space solutions throughout the county. So we have 7 space partnerships throughout Westchester County, another 10 or so throughout the tri-state area. They include office space shares. They include partnerships with community-based organizations. So we are always open to partnering in spaces at community centers or at schools and other things like that. So we have a lot of these space partnerships already in the works, and it allows us to disseminate our clinical services in specific neighborhoods of need throughout the county. We're also currently exploring some additional space partnerships in Mount Vernon and the Bronx. We're also one of the first, I believe, one of the first mental health organizations in the area to offer secure telehealth services for families in more remote communities who were previously unable to access more specialized care. But of course, telehealth, it comes with its own limitations due to issues of digital equity, and with many families not having consistent access to a computer or internet. So we also offer in-home, in-school, and other on-site services whenever possible. And it's certainly something that we're going to be exploring with the 62 after-school program sites in our My Wellness partnership.
Awesome. You're ahead of all my questions because I think you just also answered my next question, which is...
I tend to talk a lot, so
It's perfect. If anything, my questions can just then be more of a platform to expand. But the Child and Family Institute serves many populations of people. Is there a specific age or community with growing need?
Yeah, so all of our therapists and behavioral health and learning specialists have additional specialized training working with children and teens. But we also work with parents, adults, and family members of all ages. One area I think that we're seeing increased need, and it happens to be my personal favorite population to work with as well, is young parents. So I personally think there's so much rich and rewarding work that can be done through compassionately supporting parents to learn how to best support their children who may be experiencing emotional and behavioral challenges through positive parenting practices and again, personally, as a father of 2 young boys, I really find working with parents and young families most personally rewarding and relatable and meaningful. And I guess on a related note, I'm actually at the very, very early stages of developing a new type of treatment program for young parents called Compassion Focused Parent Therapy, or CFPT, which combines the most evidence-based positive parenting strategies for child anxiety and behavioral issues with compassionate, parent-centered therapy drawing from a number of different theoretical orientations, including cognitive behavioral therapy, dialectical behavior therapy, compassion-focused therapy, acceptance and commitment therapy, schema therapy, shame resilience, and attachment-based work. And CFPT kind of understands that each parent brings their own psychological and cultural histories, including intergenerational trauma, into the therapy room, which is deeply connected to their personal views on parenting, their strengths and limitations as a parent, as well as their desire, readiness, ability to implement evidence-based parenting techniques to create lasting change in that parent-child relationship. So in a sense, the therapist-parent relationship is kind of like a microcosm for rebuilding the parent-child relationship, providing things like structure, safety, perceived control, skills to manage difficult or unwanted emotions, and importantly, clear paths toward progress and success for both the parent and the child alike. So I'm really excited to develop this treatment in the coming years. We see the need continue to grow in this area.
That's really exciting. I'm glad that you were able to kind of mention that on the podcast and mention how you continue to grow it, because I think it's important to note that if there is mental health needs that need to be addressed, oftentimes it should be addressed as a family unit, not isolated to the child or isolated to the parents. It often goes hand in hand. So I think that's a really important thing that you're doing, and I think it's very, very smart to address it in that way. So
Oh,
that's
thank you.
awesome.
Absolutely, yeah.
Yeah,
You're right.
that's great. So now, of course, we have another pilot program that's being launched that was just named My Wellness, and WCA has had some involvement with that. Before I even start asking questions about it, would you like to explain it briefly?
Yeah, in a nutshell, we are partnering with the WCA and the Westchester County Youth Bureau to provide free therapy to the county's 62 after school programs in our communities throughout Westchester. So yeah, that's like the one liner, but we're really excited about it.
Awesome. Now, WCA is not a direct care provider like the Child and Family Institute and the Weissman Children's Foundation. So, what is the benefit of partnering with another organization and having the county support during this pilot?
Yeah, there's enormous benefit. And I guess I'll just preface my response by sharing a little bit more. Like, the last year, WCF launched our Phase 2 Community Wellness Initiative, which, along with providing free and pay what you wish care to underserved families, similar to our mental health relief initiative, also evaluates clinical and cultural outcomes, including trauma, anxiety, depression, and behavior symptoms, therapeutic alliance, and cultural sensitivity and satisfaction. In doing so, going back to issues of stigma for a minute, over the past year, our team at WCF has actually developed the field's first clinician cultural sensitivity and satisfaction questionnaire to evaluate families' experience of our therapists' cultural connectedness and humility, to shed light on and help mitigate both financial and cultural barriers to equitable care. So we want to see, like, number one, are the evidence-based treatments that have been designed at top academic institutions, often tested with white college students, actually equally effective with underserved communities of color, historically denied access? And number two, are we being successful at reducing our two hypothesized greatest barriers to equitable care, which are cost and issues of stigma, shame, and lack of cultural sensitivity? And so it's important to highlight that our My Wellness partnership is built on these very same values and foundation. And I guess before speaking more about the pilot program, it's also worth emphasizing that WCF's early success is a direct result of tremendous community support and the backing of local government and advocacy groups like the Westchester Children's Association, and that these tailwinds have been, further strengthened by WCF's lean budget, in which we leverage pro bono partnerships and strong relationships in the mental health field and in our community, built on reputation and trust, and which has resulted in pro bono legal services and accounting and nonprofit business coaching and program evaluation and a network of over 50 clinicians from the Child and Family Institute, all of whom, by the way, are streamlining care via an innovative electronic health record and program evaluation software, which has been donated to our cause. So all this means that all the services I just mentioned aren't costing us anything, which means that any grant money or donations coming in goes 100% to our clinical programming. So that's pretty cool. And that, all that being said, the My Wellness partnership in particular, in the backing of WCA and the County Youth Bureau, really couldn't have come at a better time, and has sort of created a new echelon of visibility and credibility for our work and mission, allowing us to collaboratively pilot a centralized countywide mental health program with the potential to help, I think, probably hundreds, if not thousands, of children and families in the coming years. and serving as a model, right, for other county and state governments to learn from and potentially replicate. So this is indeed a very, very special and potentially impactful opportunity, and we're very grateful.
Awesome. No, we're very excited for it. WC can't wait to see everything that we're going to accomplish with this partnership. And of course, we have many programming platform issues ranging from youth justice to child homelessness and child poverty and early childhood home visiting. So to now add an element of mental health to our programming, it's a very important milestone for us. And it's all interconnected in a way as well, which is very important to address.
Yeah,
Uh,
absolutely.
yes. So, leading to a question about my wellness, and also, I guess, building off of what we've previously spoken about with accessibility, what benefits would direct care in an out of school space have for children and families?
Yeah, I think there are a number of potential benefits. I think the first things that come to mind would be like convenience, um, and also privacy, confidentiality, anonymity, things like that. But at the same time, I don't know. I would kind of like to see mental health services become destigmatized so that children and adults no longer feel like it's something they need to hide and do kind of, you know, I don't know, under the radar or something like that. Um, and feel ashamed about. So, uh, just kind of like a sidebar here. For start, I'm very much in favor of like systematizing something like annual mental health checkup, like when we go to our PCP or our pediatrician for an annual physical, or even when kids like might go to the school nurse for a cut or a scrape. Um, I think it'd be great to have us institute a system where it's not taboo to like have to have services somewhere really like private or whatever the case may be. But right now that's where we are. So I think there's different pros and cons to every type of mental health setup, including direct care models both in and outside of school. But I think that, and it's great for convenience for folks to be able to have a setup in their neighborhood where they can go and they can access care, especially if it's integrated to other programs. But I think that normalizing and instituting routine mental health checkups for everyone, regardless of the setting, would be a really wonderful thing to do.
I think so as well. I think it makes sense, to do that as well. Like physical health, mental health, they go hand in hand. I think it's important. And like you said, having a routine checkup that is kind of implemented into your normal routine is important as well. Yeah. So I'm almost out of questions. This is my last question that I have, written down. But obviously, this is a pilot program. What do you hope this program will accomplish in the future, or maybe even set a precedent for in terms of future projects?
Yeah, that's a great question, Gabby. I guess first, just to recap and summarize, since this is our last question, um, the 5 core goals of both WCF and our My Wellness partnership are: number one, to offer free, culturally affirming, evidence-based care; number two, supervised by nationally renowned experts at the Child and Family Institute; number three, to mitigate barriers related to time, cost, limited and complex networks, and stigma and cultural insensitivity; number four, via a model that has the ability to scale exponentially as funding increases, including five, a growing network of highly trained pro bono therapists, which, side note, will be WCF's Phase 3 initiative launching in 2024. On a clinical level, we hope for the pilot program to substantially reduce rates of anxiety, depression, trauma, and behavior symptoms in the individuals and families that we're serving, while demonstrating strong therapeutic alliance, cultural sensitivity, and satisfaction. And looking ahead, we hope to nurture and grow our new partnership and relationships with wonderful, talented folks like Allison Lake and Dr. Damia Harris and Michael Orth and local mental health leaders and stakeholders to perhaps develop a youth mental health equity council, streamlining. I would love to see kind of a streamlining of clinical programming, education, and countywide, and maybe eventually statewide access to care, with the hopes of helping thousands of children and families in the coming years. And also offering, again, a feasibility and implementation model for other county and state governments to learn from and replicate.
Awesome. So this can really be a program that, I guess, launches future efforts and really sends forth more mental health support, right?
I hope, like proof of concept, right?
Yes.
And then be able to make some more systemic change.
Awesome. Great. This has been a great conversation. I don't know if there's anything else you'd like to add, just because this is like Zoom offers a limited time slot. Like we have like 3 minutes left, but I could also yeah.
I mean, I think that just some additional kind of thoughts. I'll add that beyond mental health, I think we also really hope to collaborate with and support interdisciplinary social service organizations, including those developing innovative solutions for things like homelessness, food insecurity, education and job training, digital equity, right? As we deeply understand and appreciate that social, economic, and health justice are all interconnected, and that we must first be able to meet our most basic needs in order to tend to our mental and emotional health and well-being, right? So that's something that I really like to think more about. And I'm already having conversations with folks from Feeding Westchester and different organizations to put our heads together a bit. But besides that, I just want to say thank you to you again, Gabby, for having me on the podcast, and it's been a lot of fun. And thank you to, obviously, to the Westchester Children's Association. I hope that this is just the beginning of a long and meaningful partnership for many, many years to come.
I know, I hope so too, and it's good to have people like you on the podcast who, represent efforts for child and youth and family, honestly, mental health support. We hope that in the future we can expand upon our efforts on WCA's end, but also through our partnerships, such as the one with the Child and Family Institute.
Yeah, me too. Looking forward to all that. Thank you again.
Thank you so much. All right, awesome.